Great. Thanks very much, Bill. And good afternoon, everyone. Welcome to our weekly media information session on COVID-19. As Bill mentioned, my name's Natalie Bocking. I'm the Medical Officer of Health with Haliburton Kawartha Pine Ridge District Health Unit. And we have been offering these weekly information sessions for quite some time, in almost a year for me. So thank you for bearing with us and continuing to join. I think our session today will likely be a little bit shorter as thankfully there's not as much activity going on with COVID-19. So I think some continued cautious optimism is the key word. My update today will follow the same format as previous updates, so I'll provide a couple of key numbers for the region in terms of COVID-19 activity, some updates regarding vaccination, and then a couple final updates and comments related to public health measures that are key to the prevention of transmission of COVID-19. So to start with, we're continuing to see an improvement across indicators in terms of decreasing transmission of COVID-19 across all three regions of the health unit jurisdiction. We've had a decrease in the daily number of new lab confirmed cases. Our test positivity is still staying about the same, around 10%, and it's hovered that way for the past 2 weeks now, but continuing to come down slightly. The number of outbreaks currently declared sits at 8, or at least that's what it was earlier this morning, with only 2 of those now in long-term care homes and retirement homes. So a significant improvement in the number of outbreaks that are ongoing. Our wastewater surveillance has indicated a significant decline in viral signal at in the sewer shed for the town of Cobourg. And the wastewater surveillance set up for the Lindsay area sewer shed did show a slight increase last week, but certainly not at levels that it previously was when it was the height of the Omicron wave. So while we're not at a level that we were prior to this Omicron wave, we're certainly in a much better position than we were several weeks ago. And I think we're continuing to see those indicators improve and trending in the right direction. A couple of comments just related to the impact of the Omicron variant on hospital admissions and severe outcomes associated with COVID. So these numbers are as of are since January 1st of 2022. So really trying to reflect the impact just of the Omicron variant across our region. We have had a decrease in the rate of people being admitted to hospital with COVID-19 infection. So only 3 new hospital admissions in the past week and a total of 62 hospital admissions from COVID-19 since January 1st. ICU admissions thankfully have stayed the same at 13, and we have not had any new deaths with 23 deaths currently reported across our region since January 1st. All of those numbers will at times increase by 1 or decrease by 1, sometimes by way of what we refer to as data cleaning. So if when we go back, we ensure all of the information is accurate, or there might be information that is updated. So for example, if we receive a death certificate from someone with the cause of death listed, we try to ensure that our numbers are accurate and are reflective of the true burden of disease associated with COVID-19. I'll move now to a couple of updates related to vaccination. So firstly, with regards to coverage, we have certainly seen a decrease in our increase, the rate of increase of coverage. So with regards to booster doses among the population that is age 70 and over, 85.1% have received their booster dose. Among the population age 50 and over, 73% have received their booster dose. And among the population age 18 and over, 60.2% have received their booster dose. Among the population age 5 to 11, so our pediatric or our kids, 47.6% have received their first dose of COVID-19 vaccine. So as I mentioned a minute ago, these numbers for both booster doses as well as among the 5 to 11-year-old age group continue to increase, but much, much more slowly than what we saw a couple of weeks ago. And this is also reflected in the numbers of individuals that we're seeing at our COVID-19 clinics. In terms of access to vaccines, so we continue to host health unit-led clinics at a number of different locations across the region. You might have seen the media release issued earlier today, I believe it was, related to upcoming closure of two of our largest health unit-led immunization clinics. So the clinic that's currently hosted at the Cobourg Community Centre, or CCC, will have its last day on February the 26th. And our clinic that is currently hosted at the Lindsay Exhibition grounds, or the LEX, will be closing on February the 25th. Now, we will continue to have clinic opportunities in Lindsay as well as in Port Hope Cobourg area. We will be starting clinics at the health unit offices in Lindsay and in Port Hope with initial dates and times to be confirmed in the upcoming week. We will continue to hold our weekly immunization clinics in Fenelon Falls as well as in Minden to ensure access to vaccination opportunities in those locations. We're also continuing to host school-based vaccination clinics, both during school hours as well as some clinics after hours at schools in a number of locations, again, across all three geographic areas of the health unit to improve access to vaccination for our younger community members and their families, household members, and education staff as well. As always, we know that there continue to be vaccination opportunities at pharmacies across the region, as well as through many of our primary care partners. I did want to say in relation to our two largest clinics that are closing, and we will of course do, I think, a more formal thank you as the time gets closer, but as always, I wanted to thank our many partners and the health unit staff that have made these clinics such a success. So this includes our municipal partners, all of the primary care or other healthcare provider partners that have volunteered to be vaccinators at these clinics, and of course the other volunteers that have supported the functioning of these clinics. So in particular, the Rotary Club of Cobourg at the CCC has played an instrumental role in supporting these vaccination clinics, and I think we will be eternally grateful, and I know the community is as well. There have been a couple of changes or updates related to guidance for vaccination against COVID-19. You likely saw the recent provincial announcement that youth aged 12 to 17 will be eligible for booster doses of the Pfizer COVID-19 vaccine, so starting this upcoming Friday. I believe Friday, the online booking system will be available for appointments for this age group. The difference in guidance for booster doses for this age group is that the recommendation is there be 6 months between when the second dose was and when they get their booster dose. This is different for age 18 and above, where the current recommendation from the provincial government or provincial guidance committees is that there can be a 3-month interval between the second dose and the booster dose. So for the youth age group 12 to 17, a longer interval recommended between their second dose and their booster dose. But we know that certainly eligibility is opening up and will continue to ensure that there is access to vaccine for those youth and families that are seeking to receive it. Finally, I'll provide a couple of updates just regarding other public health measures or non-pharmaceutical public health measures. As you know, the province has announced a number of changes and updates regarding lifting of provincial restrictions or public health measures related to prevention of transmission of COVID-19. The first of these changes begins on February the 17th. which is an increase in limits for private social gatherings, as well as an increase in capacity limits in many settings. I think this is certainly a much welcomed announcement for many of our key businesses and employers across the region, as well as by families, community members, community organizations, everyone looking forward to a time when we're less concerned about COVID. The province has also indicated an accelerated timeline for further lifting of measures, with March 1st communicating that other proof of vaccination requirements will be lifted as of March 1st of this year. So I think certainly, again, the cautious optimism that we are feeling in relation to all of our data indicators indicating that COVID-19 transmission is decreasing, and looking forward to many of these measures being loosened. Otherwise, I think with that cautious optimism and knowing that some of the very the stricter measures or other measures are being eased, I would encourage people to be aware that COVID-19 is still present in the community. So I mentioned earlier that we're certainly in a much better place than we were at the peak of Omicron, but we're not quite back at the level prior to Omicron at all. And we'll likely continue to see some ongoing transmission. It might increase a little bit with lifting of other capacity limits, but the key to that being that our healthcare system is able to accommodate it. In order to help prevent further transmission, knowing that there's still COVID-19, I do encourage anyone that has not been vaccinated yet to receive your COVID-19 vaccine. And then underlying key messages: if you're feeling sick, stay home. And if you're in an indoor space and not able to distance from individuals outside of your household, I think there is an important continued role for mask use at this point in time in helping to prevent transmission of COVID-19. So please don't, in your enthusiasm, throw out all of the measures that we know have helped to protect us and our community members and our loved ones for the last 2 years. Continue the ones that we know work well as we start to ease some of the others. And I did want to thank really all of our community members, our partners, for continuing to be vigilant, to be supportive, and to be compassionate to your neighbors as we come out of this most recent wave and we look to the future and starting to do more of the things that we have been missing out on. So with that, I think I'll end for today, and happy to answer any questions. And back to you, Bill.
Thanks, Dr. Bocking. I appreciate that update. We will open it up to questions from the media. If you want to just put up your hand or type something into the chat box, we'll do an initial question and follow up, and then we'll open it up once everyone's had a turn to ask. So I see, first of all, Dan from the Standard. Go ahead if you want Dan to ask some questions.
Thanks, Bill and Dr. Bocking, as always. Just first off, wanted your reaction to the Premier's comments yesterday, where he basically said that some of the provincial politicians are kind of almost fed up with restrictions, or that some we're pretty well done with those.
I mean, I think from everyone's perspective, what I'm hearing really is people are kind of done with COVID, right? Everyone is tired of public health measures. Everyone's tired of public health always talking and reminding them. And I think what we also continue to remind people is COVID-19 as a virus doesn't really care when we're done with it. It's certainly still here and will be for quite some time. And so I think really it's up to us to be responsible, to look after our communities and continue to pay attention. So as much as we want to be done with it, it's not something that we can just kind of close the cupboard on just yet.
Okay. Yeah, and some on the school-based clients, I guess So how will the notification of those work? Will it be just notifying parents, or will it be more of a public listing of schools that where these will be available? Or
So to date, the process has been that a consent form is sent home with every child that's attending school in that age group, 5 to 11, and then parents will sign the consent form if they do consent and send it back to school. The parents are then notified of the date of that vaccination clinic at that school, so that they know that their child will be vaccinated on that day. And then a general notice is also sent out to all of the families of that school, notifying them that a vaccination clinic is taking place. Because most of those clinics are not open to the general public, there hasn't been a need to advertise kind of broadly where those clinics are being held on any given day. But certainly all of that school community is aware, so that they know what the opportunity is for kids to attend to be vaccinated with their parents' consent.
okay, great, thanks.
Thanks, Dan, for that. I'll turn it over to Sam from the Highlander. Go ahead, Sam.
Hello. So recently, I guess in the past week or so, people might have gotten their hands on rapid testing kits, and they haven't really been available up till now. I was wondering, in the current kind of state of Omicron and with what you're seeing as far as transmission goes, do you have any advice about how to best use those COVID testing kits, especially when they're administered by people, everyday people, like before seeing people, only when symptomatic? What would you suggest?
Right, thanks. So at this point in time, in the Omicron wave, my advice is that the rapid antigen tests are still really used more as a diagnostic opportunity. So if you have symptoms, that you're using the rapid antigen test to really confirm whether or not it's COVID or not. If you have symptoms and that first COVID test is negative, I wouldn't take one negative as confirmation that it's not COVID. I think the current science has indicated that if you have two negative rapid antigen tests at least 24 hours apart and your symptoms are improving, then maybe you could consider that to be negative. But certainly if you have symptoms, one negative COVID test, I wouldn't rule out COVID at that point in time. I think if you don't have symptoms and you're looking at whether or not you can use the rapid antigen test to, for example, attend other gatherings without other public health precautions like masking, that sort of thing, I'd be a little bit concerned because we know there's still quite a lot of COVID-19 circulating, and we know the tests aren't perfect. And so with the amount of COVID circulating, you could still have a test that's negative and have COVID-19 and be at risk of passing it on to somebody else. So for me, the primary use right now is still if you have symptoms and you're looking for that diagnosis of COVID-19. I think the other key thing in terms of when you're thinking about use of rapid antigen tests, there is some emerging evidence about how to actually do the swab itself. So before really, it's been recommended to just do the nasal swab. And there's some evidence to support that, especially with the Omicron variant, if you do a mix of both like a mouth throat swab and a nose swab together in that same swab, that you might have higher sensitivity or you might have a better chance of actually catching the virus in that swab when you do the test. So there's some good information on the Public Health Ontario website in terms of how to do that. And I'd encourage people to look at that if you're really trying to get the best use out of that rapid antigen test.
Thank you. That's all for me.
Hey, thanks, Sam. I'm going to turn it over to Catherine from Metroland Media.
Yes, hello, Dr. Bucking. Back to the in-school clinics. What's the uptake been on that? I think the consent forms had to be sent back last week. So what kind of numbers? Has there been a positive uptake? And how many clinics are actually planned? Because I think initially it was slated at about a dozen. Is there more or are there less?
So thanks for that question, Catherine. So the first clinics were held last Friday, so the clinics have started, and the uptake certainly ranges by school, with some schools having maybe 5 or 6, and some schools having maybe 15, 16 kids that consent forms have been received for. I don't know the total number of positive consent forms, and we're actually still receiving some consent forms, as there were 2 rounds with some schools having received consent forms earlier than other schools. So I understand that we're still receiving some and tallying those numbers. I also don't know the exact number of school clinics currently scheduled, but I know that we were at a number closer to 25 or so when I last spoke with our team. And again, those numbers may increase depending on additional consent forms that are received. So we started with a certain set of schools in areas that we knew had lower coverage and wanted to ensure there was vaccine accessible. And then look, other schools that we've had a good uptake from, then we'll be sure to be hosting clinics in those schools as well.
Not to point any fingers, but is there a region of the healthcare unit that or the health unit that has that higher need than others? Like, is there more schools in Northumberland or more schools in Haliburton being involved in this?
So I mean, I think I could speak in general terms because I think it's reflective of vaccination coverage for all ages across the health unit jurisdiction. And we have seen that more rural areas have tended to have lower uptake than more urban areas. So like Cobourg, Port Hope might have a higher vaccination coverage than some of the more not outlying, outer rural areas. And I think we're seeing that consistent with the vaccination coverage rates in our younger age groups as well. Otherwise, sorry, coming back to that point, I mean, some of that might just have to do with access, and which is why we want to ensure, certainly in rural areas, that we're making vaccine accessible, as those mass immunization clinics might not be just down the road the same way they are in some of the larger towns.
Okay, thank you very much.
Thanks, Catherine. I'm just going to go to a quick question from Cecilia on the chat box, and it's her question, Dr. Bocking, is, would you recommend continued masking for vulnerable individuals, the immunocompromised?
At this point in time, I would recommend continued masking for vulnerable individuals. I mean, even with a booster dose of COVID-19 vaccine, we know that the vaccines are not perfect. They're not 100%. And we know that individuals that are immune compromised or that are elderly are at higher risk of more severe illness from COVID-19 infection. And we know that COVID-19 virus is certainly still around. So I think we still have room to improve with our indicators. And at this point in time, it would be prudent to still be cautious.
That's great. Thanks for that answer. Hopefully that addresses your question, Cecilia. I've got Dan has his hand up again. Before we do, I just wonder if any other members of the media have a question that haven't asked one yet. Just before we open it up to everyone else. I don't see. So Dan, why don't you go ahead with your question?
Okay, thanks, Bill. Just following up again on the school clinics. So you mentioned that the uptake has varied from schools to school. I guess was there a threshold of interest for a school to host a clinic? I guess a set number.
So there's not actually a set number. You know, our teams are committed to supporting vaccination really for any kids whose parents are consenting and wanting them to get vaccinated. So there might be schools that the team would attend and support, only a handful of vaccination, and then there'd be other schools with a larger number. If there is a school that we don't have a clinic at, and we receive a consent form from a parent that indicates they'd like for their child to be vaccinated, then we would also be reaching out to that family to try and make sure that we facilitate access to vaccination for them in whatever's the easiest way for them to access it.
Okay. Yeah, and some on the one recent provincial announcement about some lifting of proof of vaccination on March 1st. There's still an option for businesses to keep this in place, and I guess what is your advice to businesses that may be more hesitant, but don't want to face any sort of issues with people trying to, or just people calling them out for keeping the in place?
Mm-hmm. But I think what's important to remember is that business owners are going to do their assessment of their business and the clientele that they serve, and will need to make decisions based on what they think is best for not just their business, but also who they serve. And so, there might be some settings or businesses that cater primarily to a much older age group that would be at higher risk, and in that setting, maybe it would make sense and be quite accepted and promoted to continue. So I think we should expect to see some variation, and I hope that business owners take this opportunity to revisit their COVID safety plans and look at what measures they do have in place to try and prevent any transmission that might be occurring in different settings.
Okay, perfect. Thanks.
Thanks, Dan. We're going to go again to Catherine. You have your hand up. Is that an old hand, or do you have some more questions?
That is an old hand. I apologize.
No worries. No worries.
There we go.
I wonder if anybody else has questions before for Dr. Bocking. I do not see any. Calling one last time. Any questions? If not, then I guess we will. You called it right, Dr. Bocking. Short and straightforward and good information. We appreciate everyone joining us for today's session. Thanks to Dr. Bocking for her update. Always good information. We will be here again next week at the same time and for the next update. So have a great rest of the day, everyone. Thanks for joining us, and take care.
Thanks very much. Take care.